All right. Welcome to our professional development session. We're going to talk about how effective teams can impact quality outcomes in healthcare. My name is Michael, and I'm excited to guide you through this topic today. So in this session, we're going to talk about and explore the significance of teams in quality improvement. We're going to talk about the traits of high-performing teams. We're going to talk about the influence of different team processes and roles, and then we're going to address the benefits and challenges of having interdisciplinary teams with different experience. We'll move on to the impact of conflict and change in the workplace, and then we're going to discuss some resources that are available to support our teams. So we're going to start with a quote. This is from Coach Joe Paterno, who coached at Penn State. It says, "When a team outgrows individual performance and learns team confidence, excellence becomes a reality." This is a good quote for just encouraging teamwork in the workplace, and maybe taking that individual performance measures and incorporating it into the team setting, and overall improving quality outcomes, especially in patient care for our clinics. So why focus on teams? So teams are the backbone of quality improvement in healthcare. They can bring together diverse perspectives and expertise and create a sort of synergy that drives better outcomes for patients and more efficient processes for our clinics and the hospital itself. For example, a multidisciplinary team working on patient safety can identify potential risks from different angles, from different paths, and ensure they reach a comprehensive solution to resolve different problems. So what makes a team high performing? So a high-performing team in healthcare is characterized by clear goals, well-defined roles, effective communication, and mutual trust. These elements lead to improved patient care, to streamlining processes in the clinic, and to higher satisfaction from staff as well. I think when everyone knows their roles and communicates them effectively, we see a significant positive impact on quality outcomes as a whole, not just patient, but overall processes in the clinic. Creating a positive team culture helps foster collaboration, innovation in the clinic, improving processes, improving patient satisfaction, just overall interactions in the workplace. Encouraging open dialogue between patient and provider, between staff members, providing regular feedback through all these processes, and then celebrating successes as a team, as a cohesive team, significantly helps the work environment as well, and the quality improvement in the healthcare. And then continuous improvement should be part of the team's culture. So, when we come into work every day, we do our huddles in the morning, continually improving on the processes, doing closeout huddles at the end of the clinic day, incorporating that feedback into our day-to-day operations, and having every member of the clinic, of the staff, committed to ongoing learning and development through these PDs, for example. Another example would be regular team meetings to review performances. So outside of our day-to-day operations, have team meetings for not only individual performances, but how as a team we can improve. So discussing different strategies to improve the quality management for the clinic. And this can help the team align with overall organizational quality goals. So team processes and some individual roles. So leadership, individual responsibilities, delegating stuff, and decision making, these are all critical to team success. So effective leadership looks like direction and support. It looks like clear roles to maintain accountability. It looks like proper delegating, task management properly. However however that delegation is decided. And then we talk about like continuous training and education. So constantly improving, constantly learning. These are all kind of essential things to keep our teams skilled and informed on any, whether it's policy updates, regulatory updates, whether it's feedback from reviews or what have you. On the other side, you get poor leadership in the clinic, or you get those unclear roles for, whether it's delegating tasks or whatever, unclear roles. This can hinder our progress, and it negatively impacts our quality assessments. So not only does it not move us forward, but it can move us backward. So cross-functionality and interdisciplinary teams, they bring together this wealth of knowledge and skills. It enhances our problem solving and innovation. It creates this environment of change and environment of sharing knowledge and understanding different people's skills. So an example of this would be a team that's addressing chronic disease management. You can look at different care plans, developing different comprehensive care plans that take in all aspects of a patient's health. With chronic disease management, it's never one thing. So taking different disciplines, different team members with different disciplines, and creating this comprehensive care plan, considers every aspect of a patient's health. But that being said, different priorities in the process can lead to conflicts. So to mitigate these tensions and conflicts, we need to have clear communication channels and comprehensive or robust conflict resolution protocols. These teams might face challenges such as different viewpoints and priorities. However, they have to be managed through whatever we can. So team building activities, whether it's regular meetings between departments, whatever it has to be, because establishing that shared vision and common goals helps align the team's efforts. And conflict resolution training is an important one too, and because that can help equip different team members with the skills to handle disagreements constructively and move forward as a team. Managing conflict and change. So conflict and change, they're inevitable in this profession, really any profession, any workspace. It's going to happen, but the goal is to not let it disrupt the team, the harmony within the team, and to manage it well. So open communication, adaptability, these are both key strategies to navigate these kinds of challenges. Making sure the team remains focused on the goals, like during any, for example, during any major organizational change, there has to be, whether that's leadership, clinic leadership, administrative leadership, hospital level or clinical level leadership changes, there needs to be this clear and concise communication to alleviate any uncertainty for staff, or just to keep the team aligned with any new changes. So if priorities shift with new management or new leadership, those new objectives need to be outlined, clear and concise, and addressed appropriately. So to enhance our team efforts, we need to support our teams. We need to provide them with the right resources, it's a crucial step in the continuous improvement process. This might include training programs, technological tools, administrative support, because I think creating a positive team culture, effective communication, recognition of achievements, these are important for motivating teams. Like a team reward program, hitting targets, hitting metrics, whatever it may be, whether it's reducing patient safety reports, whether it's reducing wait times in clinic, whether it's reducing the time between the when the patient arrives in the clinic to when the provider sees the patient, just overall time in clinic, reducing that time, meeting those targets, and then appropriately addressing and rewarding helps boost morale and encourages the continuous part of this process, because it's a continuous process. So in summary, effective teams are essential for quality improvement in healthcare. By creating these high-performing interdisciplinary teams and providing the necessary support, we can achieve better quality outcomes, and committing to this continuous improvement and working together can make a huge difference in our profession, in our workplace. So I appreciate your attention. If you have any questions or need further support, please reach out to me. Please provide any feedback. Feedback is always valuable for these kinds of things, and I welcome any suggestions for the future. Thank you.